Hi, I'm Dr. Michael Workman, board certified plastic surgeon out of Vancouver, Washington. And today I'd like to briefly discuss one of the questions that we get from time to time. And a woman will call in and say, doctor, I can feel a ridge or something funny in my breast. And this is usually following breast augmentation. And typically what's going on is a patient is actually going to be feeling the edge of the implant. So if you look at any implant that's inside the body, there's going to be a palpable edge of that implant. Now normally, depending upon how thin you are or how much tissue you have, there'll be anywhere from 2 millimeters up to maybe 2 inches of tissue covering that edge of that implant, and actually the entire implant. So that sometimes if a person loses weight, if there's been thinning at all of the breast tissue, this border of the implant, which is always there, becomes more palpable. And so I think in most cases, all you're feeling is the actual implant. This can be more noticeable when if a person has a saline implant in. Here's a saline implant. And for a variety of reasons, these implants oftentimes will have palpable ripples, or you can actually feel the edge of the implant. Whereas if we switch that same person from saline over to the silicone, oftentimes, due to the just the characteristics of the gel implant, that will solve that problem, but not all the time. I think if you're still thin, or if you've had continued drooping, or what we call ptosis of the breast, even with a gel implant, and sometimes it's positional. Maybe it's just in a certain position where you can feel the edge of the implant. I think most of the time there's nothing to be concerned about. I mean, I think as long as you've had no other symptoms in terms of nipple discharge or new lump or mass or anything like that. But I think it's always a good idea, if you have a question, to talk to your doctor and have them examine you just to make sure. So anyways, bottom line here is, in terms of the take-home message, if you're feeling a new ripple or an edge in your implant or in your breast, probably better off to go in and see your doctor. However, the large majority of the time, it's just going to be the edge of the implant that you're feeling through your natural tissue, and there's nothing to worry about. So, thanks much.